So my name is Gabriella Francis. I like to consider myself a maker, a tinker, a disability advocate. By background, I'm also an athletic trainer and a certified and licensed occupational therapist. I practice inpatient rehabilitation here in Manhattan. And I'm also the CEO of Squegg. At Squegg, we create smart solutions to help assess, track, and monitor various different biomarkers of upper extremity function, things like grip strength, pitch strength, range of motion, etc. Yeah.
All right, Gabby, thank you so much. So why don't we start and dive right into it? How do connected health devices work, and what is their purpose in shaping the future of healthcare?
Yeah, that's a great question. So when you talk about connected health devices, they're run across the gamut. It's everything from, consumer wearables, like your Apple Watch that tracks your steps, all the way through different devices that can actually be medically implanted and then wirelessly connect to a smart device. But I think across the entire scope, there's kind of four key elements. You think about the patient or the clinician, the patient or the client, and then the healthcare provider or the clinician. And then there's the actual device itself, and then the software system. So how they all interact and integrate with each other in an ecosystem that also allows for kind of this data sharing in real time, and hopefully, in a smart, responsible way, a HIPAA compliant way.
Yeah, absolutely. Thank you so much. And so you started talking briefly about it, but if you could elaborate on what are some examples of connected health devices that are on the market already?
Oh yeah, there's so many, and we've gotten the chance to hear from so many founders, even at this conference alone, who are coming up with such smart solutions. But there's a bunch of different things out there, from pulse oximeters, blood pressure cuffs, all the way through what I tend to focus on, which is different markers for upper extremity impairments in function. So like I said, things like grip strength, and at Squegg, that's a part of our mission of what we do. So we collect that data and then pair it with clinicians to be able to overall improve care.
Yeah, so can you elaborate on how you think connected health devices improve patient care and outcomes?
Yeah, so I think to answer that question, it's good to take, to look at it from two different perspectives. You have how it's going to help the clinicians. So we get increased data that can help with our clinical decision making. And in that process will allow us to, course correct care where needed to best serve our clients, and then also to help, them meet their functional goals. So you can see truly what's working in therapy, what maybe isn't working, and then both inside the clinic, so during direct care, and then outside of the clinic, so in between visits as well. So I think that, that's kind of how, from a clinician's perspective, this data can be really helpful. And then from the patient's perspective, being able to have objective data at their disposal, can be really motivating as well. So if they're in their course of care, they can see, it's really worth it and benefiting me to complete my home exercise program, to continue to go to therapy and follow out my course of care, because so many individuals, I think up to 70% of individuals, fail to complete their course of care. And what are the real life implications of that, right? It's not being able to get back to full strength, to get back to full mobility, to get back to engaging in these really meaningful activities for individuals, say after a stroke or a wrist fracture or something like that. So I think that empowering them to be involved in the process is key. And then you get that buy-in from them as well, which is so huge.
So that was a great response. But what do you think are some of the main challenges and barriers preventing this widespread adoption of connected health devices?
Yeah, there are many, many of which we've already heard throughout the course of this conference. So I'm speaking to experts here. But from the, implementation in the clinic standpoint, it's how do you integrate that device and the monitoring aspect into an already existing workflow. So clinicians, sometimes it's hard for us to pick up change, especially seasoned clinicians who have been practicing for 25 plus years. There's a very set way and efficient way in which they go about their workflow. So trying to integrate different pieces of information into that system, although can be very beneficial, you do see some pushback. And that's on a whole with a little bit of pushback for RTM or remote therapeutic monitoring adoption into certain clinics. So I would say that that's definitely a barrier. And the key I would say to that is to understand the clinic itself and be able to work with them and create new workflows that will ultimately save them and time, energy, make it more efficient, make it more objective measurements, and you take out that human aspect, right? Where you kind of write down a grip strength measurement and you miss a point, or you can't read your own handwriting when you come back to it. So I would say from the clinician standpoint, integrating into the workflow is definitely a barrier. And then for the end user or the patient, adoption and retention of that device into their own personal life as well can be challenging. And I would say that a solution to try and combat that would be to truly validate your user as the expert of their own lived experience, right? So that could look like sitting down, doing customer, exploration interviews, and just truly speaking to your, who you're building a solution for, truly understanding what their needs are, and then, listening and interpreting that, and then building a right solution for them. So making it really user-friendly is great. Utilizing different gamification of rehabilitation principles is also great. Things like push notifications, games, making them fun, engaging. There's also a competitive aspect, so you can connect with your friends and see, oh, I scored this on blast away game, and you get that kind of fun competitive nature to it, which can all be things to help combat some of those barriers.
Yeah, absolutely. So how do you think the adoption of connected health devices into a patient's life allows for them and empowers them to take individuality over their own healthcare and their own well-being?
Yeah. So I touched a little bit on this previously, but I think for them, seeing those objective measurements, being able to, see how they're doing over, longitudinally over time, seeing what's working for them, what's not working for them is huge. Then they also have that data that will be shared with their clinician, but say they're not currently seeing someone, they're just using it on the general health and wellness side of things. If you track it, or even if it's a chronic patient, right, where there's kind of relapsing, remitting episodes. So if you, as that individual, are consistent with these evaluations, you have a good idea of what your baseline is. So if you start to see different trends, right, if say there's a downward trend in a certain measurement, it could be a good indication for you to then go and either, seek out services, get a further evaluation done, or also just change some different modifiable risk factors in your own life.
Yeah, absolutely. So my last question for you, to put it bluntly, is what's next? What are some of the promising future developments, some trends that you are personally keeping track of, and what can we expect from connected health devices in the future, in the next 5 years, 10 years, 50 years? What do you think?
Yeah, that's a multi-billion-dollar question. But I think that, it's really important as we enter this space that we think about how it's integrated with different innovations as well. I know AI is a big topic, right? So we have all these data points, but how can we have that data and analyze it and then present it to clinicians in a very concise way in which they can take that information and use their clinical judgment to, X, Y, Z. But I think that could definitely help with some of the barriers to implementation to make the workflows a little bit smoother. So AI is definitely huge. And I think also having devices that communicate with each other, and then devices that also, all of that data is in one place. So this way clinicians aren't being overwhelmed with, say, 15 different applications or data from 20 different devices, because that can be a lot to manage. So truly thinking about how all of these devices are going to work together and in one entire system. Different bundles maybe per populations for what could be most beneficial there. But yeah, there's a lot to look forward to, and I'm excited to kind of be a part of this wave of healthcare and technology and the integration of those two.
Yeah.
So.
Absolutely. Thank you so much for your insight, and thanks for letting me step in and chat with you today, answering all my questions.
Of course.
I think that's all that I have for you.
Wonderful.
So, thank you.